Om Shri Gurubhyo Namaha, Om Shri Bhavani Shankaraya Namaha, Om Shri Matre Namaha. Namaste, good morning, good evening for people from India. I welcome you all to this edition of our Sacha Wellness series. Today's topic, as you all are aware, human hearing, disorders, consequences, and solutions. Sound is often the first source of information in our life. Hearing and listening are fundamental to the instruction, teamwork, reporting skills that are necessary to accomplish anything in life. Communication is crucial for effective planning and execution. Injury to hearing can disrupt communication and substantially affect everyone. It can result in the miscommunication of an instruction. Hearing loss can compromise the safety of everyone around you because it can diminish the ability to identify, receive, and respond to instructions. The implications of hearing loss are significant both at work and at home. Hearing is essential for maintaining relationships and connections with friends and family, fully participating in team and community activities, and experiencing life events. Hearing makes it possible to engage, listen, laugh, and enjoy many of the things that help shape our quality of life. So today we have Dr. Ram Nileshwar, who is an audiologist in Lake Charles for more than 40 years. He has been with the Hearing Center since its inception in 1987. He received his bachelor's degree in audiology and speech therapy from the University of Bombay, his master's degree in audiology from Western Michigan University, and his doctor of audiology from Arizona School of Health Sciences at A.T. Still University. Dr. Nileshwar is board certified in audiology by the American Board of Audiologists. Dr. Nileshwar holds a certificate of clinical competence in audiology from the American Speech Language Hearing Association and is a fellow of the American Academy of Audiology. He specializes in hearing rehabilitation, which includes the fitting of conventional and advanced digital hearing devices. He has expertise in diagnostic audiology and has received specialized training in the evaluation and management of tinnitus. Dr. Nileshwar works closely with ear, nose, and throat physicians, along with other specialists and professionals from the medical community in Southwest Louisiana. Dr. Nileshwar is past resident of the Academy of Doctors of Audiology and also serves on the board of directors of the Louisiana Academy of Audiology. Though we share the same last name, the similarity ends there. Caring for others has been passed on by his parents, Dr. Raja Nileshwar and Vasanti Nileshwar. I hope you all remember his sister, Anjani Nileshwar Upani, who had presented during our previous session. There will be a Q&A session. You can type the question in the chat or ask during the Q&A. I'm sure you're all tired of hearing me. Now, let us listen to Dr. Ram Nileshwar.
Mahesh, thank you so much for that wonderful introduction. Good morning, good afternoon, and good evening to all. And thank you for coming here to learn about hearing. Actually, Mahesh, your introduction to the Faculty of Hearing was everything I was going to talk about. So maybe we are done with the presentation. So anyway, it's very nice. Mahesh, thank you so much for hosting this wonderful Sacha series on wellness and everything else that you do for the community. I think we're all very grateful, and a big round of applause to Mahesh for everything that he does for the community. Thank you so much. What I'd like to do now is I'm going to share my screen. I have a brief a PowerPoint presentation that I'm going to put up on the screen. And I'll try to keep this short and sweet. I don't know about the sweet part, but certainly short. And then the sweet part is up to you to decide whether it's sweet or not. It is a topic of interest, obviously, to me, because it's my profession. But hearing is certainly a very important faculty, and we'll start the presentation now. So I'm going to share my screen. And hope you can see it here in just a moment. There we go. Can you see this now? Wonderful. Okay. So human hearing, what is the significance of hearing? As you can see, way back from the Upanishads and the Vedas, they were called the Shrutis, right? And the Shrutis were basically part of the Vedas. And let's see if I can forward this. Bear with me. There it is. That which is heard is what's called Shrutis. So all the sacred, scriptures that we have in our Hindu religion were all transferred through the sense of hearing. Speech and hearing are critical at the time. And so that's how they were transferred. So this is just a brief note that I talk about that underscores the importance of hearing. So before we actually look at the faculty of hearing, which I've said is important, we will just look at the human ear. Again, I don't intend to make a very long anatomy lesson here, but I think it's important that we understand what the ear does, and also beyond. It's not just the ear, but hearing extends way beyond the ear. So we'll just have a brief glimpse at it and then talk about the disorders of hearing, the consequences of hearing loss, and what the treatment options, management, and solutions are. So when I look in the ear, or when any physician looks in the ear, whether it's an ENT or anyone that looks in the ear, this is all you see. This is the eardrum. Of course, it doesn't look as yellow as it does on here, but that's all you can see. So, but the faculty of hearing is way beyond this. So I'm going to take let's take a brief look at the anatomy of hearing. So the ear has three parts: the outer ear, the middle ear, and the inner ear. The outer ear obviously funnels the sound into the ear canal, and then you see the eardrum called the tympanic membrane, and then the three bones here called the ossicles, which vibrate, and the sound vibrations are then transferred into the inner ear. Now, the inner ear has two components: the cochlea, which deals with the hearing, and these three canals at the top above the cochlea called the semicircular canals, and they deal with balance. But this is just the ear. So let's look at what happens after that. When the sound vibrations are received by the inner ear then transmits those signals into the brain. Obviously, we have let me go back. We have two ears here, right and left, and you'll see that each ear feeds to both sides of the brain. So the significance of what we call binaural hearing, meaning both ears working together, is important. And this is just a schematic diagram that shows what happens with the ear. So anything can go wrong in this whole chain of hearing, whether it's anything in the ear canal or the eardrum or the inner ear or down into the auditory cortex, or the part of the brain that deals with hearing, that can cause hearing issues. So now let's talk about the disorders of hearing. What are the different things that can happen? Let's talk about the types of hearing loss. The first one is called a conductive hearing loss, where it could be something as simple as a plug of earwax in the ear canals, or it could be fluid in the middle ear, It could be other types of things, but we'll delve into this a little deeper. The second type of hearing loss is called sensory neural hearing loss. And the third one is mixed, which means you have both conductive and sensory neural hearing loss. So in conductive hearing loss, as I said earlier, you can have anything that can go wrong with the transmission of the sound or the collection of the sound from the ear canal and transmitting it to the eardrum. So you can have congenital deformities, which is you have babies that are sometimes born with a blockage of the ear canal itself, which means it's not fully formed, or with even fully formed ear canals, you can have earwax impactions that can block the sound from going in the ear. You can have infections or inflammation of the ear canals that can cause the sound to be muffled when it goes into the ear. Then you've got the middle ear, which is past the outer ear, which consists of the eardrum and the three little bones that vibrate. And you can have fluid in the ear. You can have negative middle ear pressure. In Konkani, we call it kan banzala. Sometimes you feel like the ear is stopped up, and generally that is experienced when you have negative middle ear pressure, typically seen when you've either had a cold or some kind of a upper respiratory problem. And that's, everybody has experienced that at some point in their lives. Then ossicular dysfunction, which is the three little bones I talked about, hammer, anvil, and stirrup. You can have a stiffening of the third bone called the stapes. And that's a genetic or hereditary disorder, and it's called otosclerosis. And then, of course, you can have growths in the middle ear called cholesteatoma and other types of middle ear problems that can result in conductive hearing loss. So this is a problem in the conduction of the sound from the outer ear, rather through the middle ear into the inner ear. Then we have sensory neural hearing loss, which, by the way, is the most common type of hearing loss that is seen. Here, the inner ear itself is affected. The inner ear disorders could be congenital, which means from birth. It could be hereditary, could be noise induced, which means people who are exposed to loud levels of noise, either occupationally or recreationally. Where I live here in Louisiana, hunting is a big sport. People go hunting without hearing protection, and they end up having hearing issues because they have not protected their hearing. Or people that work in very loud environments where, for example, there's machinery and that can cause hearing issues as well. Then there are some systemic health issues called autoimmune disorders that can result in hearing loss. Of course, age-related hearing loss is well known to most. Systemic disorders such as diabetes, it's not just a correlation, but a direct one-to-one relationship for people who have diabetes. As you know, that can affect various organs in the body, and the ear is certainly one that can get affected. In fact, the blood vessels that supply blood to the inner ear are among the narrowest blood vessels in the human body. So when diabetes can affect other organs, the blood supply can also be affected in the vessels that supply blood to the inner ear. That can cause both hearing issues as well as dizziness and balance issues. Then there are other types of disorders called cochlear eye drops. I guess the best way for me to describe that is, when individuals have a glaucoma of the eye, there's an increase of the pressure of the fluid in the eye. It is kind of similar. There's fluid in the inner ear, and you can have an increase in the pressure of the fluid in the inner ear. That's called cochlear eye drops, and that can cause hearing issues as well. And then, of course, after the inner ear receives those vibrations, it converts them into electrical signals, and then it travels up the auditory vestibular nerve, or the audiovestibular nerve, to the brain. So the third category here is the disorders of the audiovestibular nerve. You can call it the pathways or the highways that lead from the ear to the brain. And you can have growths on the audiovestibular nerve. They're called acoustic neuroma or vestibular schwannoma. And generally, these are unilateral, which means they're only on one side, but occasionally we will see it on both sides. And that can cause problems also. These are generally benign in nature. They're not cancerous, and they're very, very slow growing. But identifying these types of issues is important so we can manage them appropriately. Auditory neuropathy. There are disorders such as neurofibromatosis and other types of neurologic issues, such as multiple sclerosis and so on, that can also cause what's called plaques in the part of the brain that deals with hearing, in addition to other parts of the brain that can cause hearing problems as well. And then, of course, there is the category of what we call auditory processing disorders, which means, you see, as I'm speaking to you now, for example, you are able to hear me, but you're also able to process my speech and understand what is being said, right? We take this for granted, but some individuals have great difficulty processing the information that's going to the brain. That's called auditory processing disorders. For example, if there's some background noise going on, some people have great difficulty identifying speech in the presence of noise, which, by the way, can happen even with the most common type of hearing loss called sensorineural hearing loss. But this particular auditory processing disorder I'm referring to has to do with the way the brain processes speech. Okay. Moving on, let's talk about the consequences of hearing loss. Mahesh actually shared a beautiful pictorial representation in the introduction when he was disseminating information about today's talk. That talked about, I'll see you at the store tomorrow or something of that sort. I don't remember the exact wording on that, but basically with different levels and degrees of hearing loss, you saw how the information is muffled or sort of obliterated. So people with hearing loss, generally what they say is, I can hear, but I can't understand clearly what you're saying. Makai ko parta, but kaslimant more sama karna, as I say, is said in Konkani. This is the most common problem experienced by individuals with hearing loss, where they feel like, well, I can hear you, but I cannot distinguish, I cannot understand the words clearly. So people with sensorineural hearing loss generally have the problem of clarity of speech rather than loudness of speech. So when someone has a hearing loss, one has to understand that it is the clarity of speech they're lacking. What are some of the consequences of having a hearing impairment? There are a lot of consequences. Among the first is isolation, feelings of isolation. If you are communicating with someone with hearing loss, it's an invisible condition, right? The individual who has the hearing loss sometimes feels isolated from conversations. They may be sitting with family and having conversations, or at work, they're having conversations, but they don't quite understand what's being said. So that feeling of isolation is one of the key consequences of hearing loss. And that when it goes untreated for any length of time can lead to depression. And that is a common consequence of untreated hearing loss. This is an important area of research that hearing loss individuals who are involved in research with hearing have been finding out, and that is what we call cognitive decline. As I showed in one of the diagrams earlier, we hear with our brain, we see with our brain, we feel with our brain. All the sense organs send the information to the brain. So when the brain is not receiving quite the stimulation from the ears, when the part of the brain called the auditory cortex, when it is not receiving the stimulation from the ears, it starts to decline in function. And what actually happens is there's something called cortical reorganization, which means um, when an individual has difficulty understanding what is being said, they put more effort into conversation, right? They put more energy into conversation. They're straining to hear. And when that happens, there are other parts of the brain that sort of help. They pitch in to try and help the individual understand what is being said. And so that results in a sort of a reorganization of the cortex. For example, individuals with hearing loss are a little more dependent on the visual cues of speech. So if someone is speaking and the person with hearing loss can actually see their face, they can pick up the cues. What we call lip reading or speech reading is very valuable to people with hearing loss. So they can fill in for what they have not heard and helps them understand. So when this is going on, there's sort of a reorganization that happens in the cortex. And that can eventually lead to cognitive decline. And that's why I think, and there is ample evidence to show now that if treated in a timely manner, we can prevent some of these consequences. Risk of falls. As I showed you again in one of the diagrams earlier, the inner ear deals with two primary faculties. One is faculty of hearing, and the second is the faculty of balance. Those three semicircular canals that we looked at, which deal with balance, and we obviously have two of those organs, one on each side. They work with each other and they help with balance. So you can have disorders of hearing that can affect both the cochlea and the semicircular canals, and that can result in balance problems. And when you have balance issues, obviously the chances of losing your balance and falling is certainly there. So people with hearing impairment sometimes are at higher risk for falls. So that has to be understood. And then some of the emotional reactions that go with someone who has a hearing impairment: feelings of aggravation, feelings of irritability, frustration, fatigue. You know, if you're straining to hear all day in what's being said, you can get tired. At the end of the day, it's very fatiguing. There's sometimes embarrassment. You know, you don't want to ask people to repeat themselves over and over again. So you just kind of wing it. You try to figure out what was said. You sometimes there's like you may smile or laugh when you're not supposed to, or vice versa. So I think this is an important emotional reaction that I think we have to understand. Of course, there's feelings of anger and sadness that also can result in from hearing loss. You know, audiologists are constantly working with individuals with hearing loss. And there are so many of my patients who have come into the office, and when they describe their issues to us as the professional dealing with hearing loss, it is very common actually to see they break down. And especially if they have come in with a child, which means they're, you know, either a parent or a child, of course, and they try to explain their problems. And this is the first time they've had an opportunity to discuss this at length with the professional. And it's not unusual for us to see the breakdown. So we always have tissue available in our offices to share with them. It's very, very gratifying actually to see that we are there to help them. And when we make a difference in their quality of hearing and therefore their quality of life, it is extremely gratifying to us as professionals dealing with hearing loss. So I think it's important to understand all of these consequences that can result from untreated hearing loss. Okay, now we'll move on to management and treatment. What are the kinds of things that can be done to manage hearing loss? Treatment options. Okay, first, let's talk about medical options. Obviously, if it's something as simple as earwax in the ear, that can be removed. And we'll talk a little bit more about this, hopefully at the Q&A session. There are earwax softeners that are available that can soften the earwax, and there are methods of removal that are very safe. We can discuss that in greater length. Then there are other disorders such as fluid in the middle ear, which a physician can prescribe medication for, and that can resolve the middle ear problem. There is a tube that runs from the back of the throat to the middle ear called the eustachian tube. And for people who have upper respiratory problems, colds, sinus problems, so on, eustachian tube sometimes can get affected. The function of the eustachian tube, which leads from the back of the throat to the middle ear, is to provide ventilation to the middle ear. So for example, when you swallow, and I'm sure most of you will try this as I say this, when you swallow, you hear a little click in your ear. And what's happening there is the eustachian tube is opening and closing, thereby allowing a little bit of air back into the middle ear space, which is behind the eardrum. And that allows for equalization of air pressure on both sides of the eardrum, and that provides ventilation. So eustachian tube dysfunction, sometimes doctors can prescribe medication to clear the eustachian tube congestion. There are other inner ear problems also sometimes, such as I mentioned to you earlier, cochlear hydrops and certain other types of inner ear problems. Sudden hearing loss is another one, which if it occurs very suddenly, it is frequently an inner ear problem. And generally steroids are recommended for sudden hearing loss. And it is important to note that if an individual experiences sudden hearing loss in one ear or the other ear, or both ears for that matter. By the way, both ear sudden hearing loss is rare. It's generally unilateral, which means in one ear. But it is very important to note that the physician should prescribe steroids within 48 hours generally of the sudden hearing loss occurring. And unfortunately, many physicians are unaware of this. So, and many patients who suffer this sudden hearing loss are also unaware. So they may visit the doctor a week or two later, or even a month later, or even later. And by then that valuable time is lost, where the steroid could have taken effect on the body and possibly resulted in a favorable outcome, which means could have cleared the hearing loss. So anyway, that is a brief talk about the medical aspects. Then of course, surgical issues. If you have a hole in the eardrum, that can be patched surgically by an ear, nose, and throat doctor. They have, for example, the fluid in the ear. If that does not resolve with medication, they can put a small tube in the eardrum that drains the fluid and provides ventilation to the middle ear. So it sort of takes over the function of the eustachian tube by providing that ventilation the middle ear needs. There are other surgical treatments. For example, I mentioned earlier otosclerosis, which is a problem with the last bone. I talked about the hammer alveolar stirrup, or the stapes, the stirrup. Bone forms around it, which is generally a hereditary problem. And that bone can be removed and replaced with a titanium bone surgically, and that results, it's called a stapedectomy, that surgery, and that can result in restoration of hearing. So there are other surgical treatments also. For example, there is middle ear implants, and we'll be talking about the implants later on as well, so we can touch on that later. Then of course, for untreatable hearing losses that result in permanent consequence of hearing loss, then hearing devices are very important, and they can you can manage the ability of the individual to communicate with hearing devices, so which is hearing aids, same term that's used, hearing devices or hearing aids. And then we have the implantable devices. Bone anchored hearing aid, which is a certain type. I remember I mentioned conductive hearing loss or unilateral hearing loss. These bone anchored hearing aids are inserted in the temporal bone behind the ear, and that's a removable device. And certain individuals who have certain type of hearing loss can be candidates for the bone anchored hearing aid. So that's one type of an implantable device. And of course, the cochlear implant is certainly one that I think people have heard about. That is where individuals can no longer benefit from hearing aids, and they are then candidates for a cochlear implant. We've been working with cochlear implants in my clinic now for the last little over 2 years. Um, we are actually what's called a cochlear provider network member, and so we're able to help many people who cannot be helped with hearing aids anymore with cochlear implant. Of course, I'm not an ear, nose, and throat doctor. There are otologists who specialize in diseases of the ear, who also specialize in cochlear implant surgery. We partner with those types of physicians, and they do the surgery, but we do all the management of the hearing loss after the surgery. It's a very different way of hearing. Um, there is sort of a retraining of the mechanism of hearing that occurs with cochlear implant. So we are very, it's a very lengthy, long rehabilitation process. It can last, up to a year sometimes, but frequently, 3, 4, 6 months, they start seeing good improvement in their ability to communicate. So cochlear implant is another solution. Now, hearing devices. There are 3 categories of hearing devices. We'll spend a little bit of time on this. Extended wear, daily wear, and a brand new category called the learning hearing system. So we'll talk about all 3. This diagram that you see on the screen is actually an extended wear device. I don't know if these are available in India, but there is only one manufacturer, one company that makes this, and it's called Lyric. The way this works is there is a very small device, and the yellow seals that you see there, that's a medical grade foam, and the actual electronics is housed inside of it. And what we do is we place it carefully inside the ear canal, about 4 millimeters from the eardrum, and it stays in the ear for months at a time. It's completely invisible, so it's way down in the ear canal. 24/7 hearing, kind of like people with normal hearing have 24/7 hearing. People can use them when they're sleeping, when they shower, when they swim. Now, swimming, you cannot obviously dive into or go underwater. Of course, there's no batteries to fool with, no batteries to change, and it's a no hassles type of a solution. And it's called extended wear. Not everybody is a candidate for this. There are very specific candidacy requirements. So we go through that carefully and see if the patient is a candidate for the Lyric, and that's certainly something that we can help patients with hearing loss with. As I said before, it can stay in the ear canal for months at a time. Then the next category is daily wear. This is the most common category of hearing aids. Most individuals who have hearing aids have the daily wear hearing aids. And there are several types of daily wear hearing aids. There are different styles of hearing aids. For example, there's a completely in the canal hearing aid, which is very small and fits way down in the ear canal. There is a canal style hearing aid, which is slightly bigger, but still all in the canal. And then half shell, which means it's a little bit bigger and it fills half of the what we call the bowl of the ear, and then the full shell, which fills the bowl of the ear. Then the most common type of hearing aid that is dispensed today after the behind the ear hearing aid is what's called a receiver in the canal hearing aid, which is actually part of the hearing aid. The hearing aid itself sits behind the ear, and then you have a thin cable or thin wire that leads into the ear canal, and the tiny loudspeaker that's at the end of the wire sits in the ear. And that is one of the most common styles of hearing aids that is dispensed today for people with hearing impairment. The nice thing about today's hearing aids is that you have connectivity. So people who have hearing loss frequently have difficulty talking on the phone or hearing the TV. So now with connectivity through Bluetooth, you can connect the mobile phones, directly with the hearing aids. So people can hear phone conversations extremely well. In fact, if you think about it, we hear anything and everything around us with both ears at the same time, right? Except the phone. The phone is about the only thing we hold it to the ear. Except if we put it on speaker, then we can hear it in both ears. And that's why many people with some degree of hearing loss will put it on speaker so that they can have the advantage of hearing it with both ears. Always make a joke of this and say, Alexander Graham Bell forgot man has two ears when he invented the phone. So if you could hear the phone in both ears, people could understand phone conversations better. So with Bluetooth connectivity, they can have, very reliable and favorable conversations on the phone where they can actually understand, is what I meant to say. Then there are devices that can bring the TV, sound from the TV, that directly into the ear as well. So the third category is called the learning hearing system, which is a brand new category. It's been around about a year now. It is a very unique approach to hearing, which this was introduced by the founders of this company called Whisper AI. AI stands for artificial intelligence, and Whisper is the company. And Dwight Crow, C-R-O-W, and Andrew Song, S-O-N-G, they are pioneers in the area of learning hearing system. Actually, they've had a long history of working in high-tech industry. One of them actually was the inventor of the Facebook Messenger that most of us are familiar with. So, and they have about 46 Silicon Valley engineers that are working in their company now. And we have just started working with them. What they have done is they've selected only a few clinics around the country right now at this point, from what I understand, to work with them so that they can get the feedback from those of us that have been working with people with hearing loss for a long time and continually improve the product. What's unique about this is the earpieces kind of look like the receiver in the canal I was explaining earlier. So they have the small devices that go behind the ear and the thin wire with the earpieces going in the loudspeaker going in the ear. And then there is a brain, which is no bigger than, is probably half the size of a mobile phone currently. And the brain does all the processing of the speech. You see, in today's hearing aids, the behind the ear hearing aids, I'm talking about the conventional behind the ear hearing aids and receiver in the canal hearing aids. The processing requires a certain amount of room for the chip or the hardware, as well as the software. Unfortunately, because of the size of the chip in the behind the ear hearing aids, the processing speed and the processing capacity is limited. So with this approach, with the brain, as I was explaining to you earlier, it's a small device that the individual can carry in their pocket or purse, or even have within 10 to 12 feet of them, that does all the processing of speech and helps them understand. So what it does is it evaluates the environment. And if, for example, I'm in a very, very crowded room with lots of people and there's a lot of conversation going on, a lot of background noise, it's very difficult for a person with a hearing loss to understand. So what the brain does is immediately analyzes the environment and focuses on maximizing the individual's ability to understand speech. Okay, so It's a very unique approach, and with this, it is very software focused. So there's very little, um, I guess, focus on the actual hardware, because the hardware and the software is constantly updated. So it's kind of like a subscription to better hearing. So people who sign on to Whisper AI, both the hardware and the software is constantly updated for them. So they just pay a sort of a monthly fee, if you will, and they constantly get upgraded to newer systems. So it's a unique approach. It's very interesting. I was talking to one of the founders, Dwight Crow, and he says their goal is to make a Whisper AI the #1 hearing aid company in the world within 10 years. So, of course, that remains to be seen, but they certainly have both the knowledge base, which is the know-how and the engineering behind it, as well as the capital. Sequoia Capital is a huge venture capital group that has a tremendous amount of backing that this company has from Sequoia. So it remains to be seen how far this is going to go. Okay, let's move on. Okay, then there are hearing aid accessories. As I mentioned to you before, the hearing aid is one thing, but there are things that can be done to enhance the individual's experience. There are remote controls. We see a lot of individuals who have difficulty operating the button on the hearing aid because either they have manual dexterity problems, or the feeling in their fingers may not be very good, or sometimes due to arthritis, maybe they may not be able to feel or operate the buttons on the hearing aid. So a remote control is frequently provided. A remote microphone for people who have very severe degrees of hearing loss. There is a remote microphone, which, for example, the speaker, the individual, for example, a spouse or a child, can wear, and the speaker's voice is then sent directly into the hearing aids. So it's a remote microphone. TV streaming device, as I mentioned earlier, you can have a small device that's connected to the TV that sends the sound directly to the hearing aids. Roger technology. This is a very interesting technology. It is almost like a FM radio. In FM radio, you have a radio station that's transmitting, and then you've got the radio receiver. So it's similar technology, but it's very highly sophisticated and in groups. For example, they have a small Roger transmitter that can be placed on a table at a conference, for example, or a speaker can wear it, and it sends the sound directly into the individual's hearing aids. They even have now introduced something called the Roger On. Looks like a small device, no longer than about this, and that the individual can hold in their hand or put in their pocket, and that enhances the individual's ability to hear. So there's all kinds of accessories such as these that can add to the quality of hearing beyond the hearing aids. Remember, this is very important. This is what I tell my patients all the time. Your hearing loss is more noticeable to others than a hearing aid is, right? So if a person understands the importance of doing something about your hearing, the actual visibility of the hearing aid is not of consequence. It is more visible to the individual wearing the hearing aid psychologically than it is to others. So having a very positive attitude towards addressing your hearing needs is very important, and it goes a long way. So one's mindset means a lot. And I understand there's a lot of stigma in our society regarding hearing loss. And what will others think about me? What will they think when I'm wearing a hearing aid and when they see my hearing aid? These are very natural reactions and natural things that go through a person's mind when they're considering addressing their hearing aids or their hearing issues. But I think if you have a very positive, if I have a vision problem, I wear glasses. So if I have a hearing issue, I wear hearing aids. So if you have that attitude, I think more people will understand. And it is unfortunate that society has been seeing hearing issues, at least traditionally in the past, historically. But I think there's been a very positive approach now that I'm seeing, that people are addressing their hearing issues now more than they did before. So that's good. Okay, now this is an area I'd like to spend just a little bit of time on. I know our talk today was on hearing, but I would like to say a few words about tinnitus. What is tinnitus? Tinnitus is the perception of a sound in the ear or the head without a corresponding external sound, which means the sound is inside, but it's not caused by something outside, And generally, it is a high-pitched ringing that the individual experiences. There are other types of tinnitus as well. For example, some people hear crickets, sounds of crickets, or that type of sound that they're constantly hearing. And there are, some people hear a buzzing, some people hear, they have described tinnitus in a variety of ways to me. But tinnitus, again, is a sound inside the ears or inside the head. And basically, it is not something that is coming from outside. Mahesh, you'll have to remind me as to where we are on time. I think I'm ready to wrap this up when you are. But I will say that it is normal to hear very high-pitched sound in a very quiet room, even for people with normal hearing. Okay, where are we on time? Are we good with time, Mahesh? Okay, good. So unless it is bothersome or intrusive, you really don't need to worry about it. Millions and millions of people who have tinnitus, they live with it and they get used to it and it doesn't bother them. It's only in very, very quiet situations when they are about to go to sleep, when everything is really quiet, they hear it. There are sometimes very simple ways of addressing this. Most of the time, it is not a medically curable issue, but it is manageable. It is certainly something that can be managed where it is not bothersome. So we evaluate, as hearing care professionals that specialize in tinnitus, we also work with individuals with tinnitus and help them manage their tinnitus. The various ways of dealing with tinnitus. Some of the simplest ways, for example, is when you go to bed. For individuals who notice the tinnitus more when they're going to bed, they will leave either the fan on or they have these machines that have white noise, and they are able to mask the tinnitus so that it's not bothersome to them. They have identified certain types of sounds that are very pleasing. For example, water-based sounds, which means the sound of a brook or a river running, waterfalls, the surf, rain. These types of water-based sounds are supposed to be very soothing and are helpful in helping individuals with tinnitus. So there are machines available these days, and even you can use your mobile and you can download these. There are apps you can download for tinnitus that have these sounds. So it is certainly an area that requires more attention, and there are, I think, audiologists who need, in my opinion, need to work on this so they can help people with hearing, with tinnitus issues. Then, of course, the area of dizziness and balance. I know that you recently had a whole wellness webinar on Zoom meeting on balance, and it is an area that audiologists, physical therapists or physiotherapists, and neurologists and other physicians, there's an area of overlap, and we work together as a team to help people with dizziness and balance. One of the most common issues with dizziness is what's called benign paroxysmal positional vertigo. It's very long. In short, it's called BPPV. And there are some calcium carbonate crystals in the inner ear, in those semicircular canals I talked about in the part of the inner ear that deals with balance. And those calcium carbonate crystals will get sort of moved out of place sometimes. And when the person is laying down in bed, or when they get up out of bed, sometimes or there's a dizziness experience. Everything spins, but only for a short while, and then it goes away. And that's a very common problem, and that can be very easily treated even without medication. There is a certain sequence of head positions that the practitioner or the person who's treating the patient can put the patient through, that can move those crystals that I talked about back into where they belong, and it can completely go away. It's almost like turning a light switch off. It's that dramatic, the improvement. Um, it's called benign paroxysmal positional vertigo. I think you may all remember, we have those little toys with the small ball bearings. It's clear and it's like a maze, and you try to move those ball bearings to the center. It's kind of similar, except we can't see the ear, and we have to put the head in a certain sequence of positions and gets rid of the problem. Then there are other disorders of the inner ear called Meniere's disease, where you have ringing in the ears, hearing loss, and dizziness. There is sometimes you kind of have a hole in the inner ear, that's called perilymphatic fistula, or sometimes one of those canals can have a hole in it that can cause, it's called superior canal dehiscence. Point is, there are other inner ear disorders that can cause issues as well. Okay, I want to leave some time for question and answer. So thank you so much for your attention today. And I hope I have been able to throw some light on this very important faculty of ours, namely hearing. And will we open it up for question answer now?
Yes, thank you. Thank you. So the next part of this program will be that Ramam, you can stop the sharing. So what we will do is I have a few questions, and then I will read out the comments from the on the chat, and then I will let everybody unmute yourselves and ask the question. If you know how to raise your hand on Zoom, you can do it, so we can do it in an orderly fashion. Thank you again. So I had a few questions on hearing aid buzzing. So is there a difference with the new Bluetooth technology? Has the buzzing been reduced, or will there be buzzing always, irrespective of the type of device?
Yeah, very, very good question. This is what we technically call feedback. Feedback is, on a public address system, a PA system, sometimes a person will have a microphone, and as they are walking, sometimes they'll go in front of the loudspeaker and it goes real loud. It's called feedback. And if you think about it, the hearing aid is like a PA system. You've got a microphone, amplifier, and loudspeaker, but it's all housed in a very small case in the ear, in the device. So because the loudspeaker and the microphone come close to each other, you can have feedback. But to answer the question specifically, yes, today's hearing aids have very good feedback managers. They're digital feedback cancelers that can manage the feedback. If you talk to your audiologist, they can address this the vast majority of the time. Sometimes they just addressing the seal in the ear where the loudspeaker is in the ear, uh, and providing a better acoustic seal, a sound seal, can reduce the feedback. But yes, there are very good ways of addressing feedback today. Good question.
Thank you. The next question is about the cleaning solutions. We generally back home use pins, hairpins, safety pins, and all kinds of metal devices that you did not cover. So I was kind of concerned if there are any advanced pins and safety pins that you suggest for people back home or here. We tend to get scared of the cotton swabs, but we don't hesitate in using a hairpin or a safety pin.
Yeah, it's a very, very good question. So here in the United States, there is a very common saying. They say you should not stick anything smaller than your elbow in your ear. So think about it. Q-tips, pins, those kinds of things are not safe, because when you when you try to clean, it's very commonly used, those Q-tips and ear swabs. They are commonly used by people to clean the ear. But what happens is, over a period of time, it can actually push the wax further into the ear, and it causes an impaction of wax. So using anything such as Q-tips or bobby pins, or some people use a key, the end of a key. Please don't do anything like that. If you want, I can talk a little bit about what can be done. Mineral oil, plain mineral oil. You don't even have to heat it, just plain mineral oil. If you put a few drops of mineral oil in the ear canal, once or twice a week, just before going to bed, about maybe 3 drops in each ear, will help keep the earwax soft enough to when you're taking a shower, a little bit of water goes in the ear and washes it out. Now, if you happen to already have a lot of wax and it's really hard in the ear, then of course people use hydrogen peroxide and such, and it really breaks down the wax, and then they can wash it out. The important thing here is, if you have a history of either eardrum rupture, or there's a hole in the eardrum, or a middle ear infection or anything like that, it's better you see a physician and have them treat this, because you don't want to put anything in your ear when you have a pathway of stuff going past the eardrum into the middle ear, right? So if there is any history of ear surgeries or anything like that, a hole in the eardrum, it's best to see a doctor. Otherwise, just ordinary mineral oil will soften it, and frequently that addresses the problem.
My final question is, this question is purely from a friend. Okay, I'm asking for a friend. He's been married for 30 years, has 3 kids and a dog. He can listen to all of them except his wife. Is there any cure for that? He says he can't hear her only.
So I hope that's a joke, but otherwise this person is in great trouble.
Thank you so much.
Yes. I was just going to say, I have said this on one of my WhatsApp groups. I said, I can fix the ears, but I can't fix what's in between them. Right?
Yeah, so, it's very important. I think your diagram, when you showed the diagram between the 2 ears and the brain, I think a lot of people have the 2 ears, but what's in between is what is missing. So thank you very much. Thank you very much. So I'm going to read out some comments before I'm going to unmute all of you. Thank you so much.
Sure.
So Mridula Kalambi says, excellent presentation, educative. What would be the advice for younger generation who use earphones or headphones all the time?
Very good question. So I think the important thing here is, when they're listening to music through the earphones, if they have trouble hearing conversation, or if the others can hear the music that they're listening to, it's too loud. Okay, that's a general rule. So if I'm wearing headphones and if I'm listening to music or earphones, earbuds, if others around me can hear the music, it's too loud. So we should turn it down. That's a general rule. But the advice is, yes, it's very important to protect one's hearing, because it's a very slow cumulative process, and you can have hearing loss over a period of time if you don't protect your hearing. Yes.
Next one is from Sunila. Thank you, Dr. Nileshwar. Very informative. Can you share an email address for us to stay in touch with questions?
Certainly. And I'm going to type that in the chat, and happy to entertain any questions. More than welcome to rnileshwar@hotmail.com. I have put that on the chat as well.
Nandan Savnal says, congratulations on being part of history in the making, participating in development of learning hearing systems. Kudos.
Thank you. Thank you so much. Thank you, Nandan.
Kishore Rao says, most interesting. I'm sure many of us seniors will find a personal interest in this. I think he's talking about the technology. Yes. Shanta Chikarmani says, excellent presentation. Thank you, Dr. Nileshwar and Mahesh. Basu Gantoti says, I enjoyed your talk very much. Thank you. Sudhir Golikeri Mam says, excellent presentation. Speaking from personal experience, I've found Dr. Nileshwar to be one of the finest and most caring audiologists. So thank you.
Very kind of you.
Thank you so much. So I'm going to look for questions.
Yeah, please do that.
So how do you address the Eustachian blockage?
Very good. So Eustachian tube blockage is frequently decongestants will help. Of course, please talk to your physician, because if you have high blood pressure, sometimes the decongestants can have a negative effect on your BP. So it's a good idea to discuss this with your physician before you take any decongestants. But there are certain types of decongestants that will open up the eustachian tube. There is a very interesting device called Eustachi, Eustachi. It's rather expensive. Here in the US, it's about $60. And there's a way you can, for example, if the right ear is blocked with the eustachian tube, I would close my left nostril, put the eustachi in my right nostril, and there's a button I can press and swallow at the same time I'm pressing the button, and that clears up the eustachian tube. But before you resort to any of these types of devices, using decongestants, mild decongestants may help. Sometimes there's a procedure called the Valsalva procedure, which is you hold the nose, you pinch your nose, close your mouth, and blow, just gently blow, and that will allow air into the middle ear, and that sometimes is very helpful. Don't do that if you happen to have a very severe infection, because you don't want to blow infection into the middle ear from the throat. But if it's not infected, you can do that. Good question.
Thank you. Next question is from a stranger, Anjani Nileshwar Au.D. She says, do you suggest regular hearing checkups like routine eye and dental checkups?
Very, very good question. So in the United States, there is something called Medicare, which is sort of an insurance for all type of thing for people over 65 years of age. As welcome to Medicare examination, they are required to do a hearing test. So to be honest with you, I think anyone and everyone, just like an eye exam, should have a hearing exam, sort of get a baseline as to where you are, so that in the future, if there is any hearing issues, you'll have something to refer to. So it's a very good question, indeed.
Next question is from Krishna Chandavar. My question is whether the tinnitus could be due to perforation of the eardrum. If so, what can be done?
Yeah. So any problem with the ears, any problem, whatever it may be, sometimes even impacted earwax or a hole in the eardrum, as Krishna says, you can, that alters the signal going from the ear to the brain, you see. And tinnitus is basically a reaction of the brain to a change in whatever's coming from the ears to the brain. That's what tinnitus is, and that's the physiology behind tinnitus. But to specifically answer that question, the eardrum, if it's a small hole, that can be surgically patched, and if it cannot be treated with surgery, there are things that can be done, and I'm happy to talk to Kittu, offline to discuss this specifics about how that can be managed. Good question.
I asked the next question. Would you recommend having ear waxing?
Ear waxing, is that candling maybe? Is that what maybe Thai is asking about? Because I know I saw somebody mention ear candling. So
yeah. Okay, I understand there is no cure available for tinnitus. Is that correct? From M. Kapadia.
Yeah, so I want to address the ear waxing or ear candling issue. There is something called ear candling that is commonly practiced, where they put a candle in the ear and light it up and it pulls the, please don't try things like that. That is not a mainstream way of addressing removing the earwax, and I would not recommend that. But coming back to the understanding cure for tinnitus, that is correct. There is no cure, but I want to be very specific about what this means. If it's an organic problem, which means if your ears are stopped up and you have a little bit of ringing in the ear, when your ears open up, then the ringing goes away. Or if there is just impacted earwax or something organic, meaning physically wrong with the ear, and that is corrected, then the tinnitus goes away. But if it's a tinnitus that has been there for a long time, and it's a high-pitched ringing and so on, that is true. There is no cure for it, but there are ways in which to manage it where it is less intrusive, less bothersome, where you're not as aware of it, and during the course of the day that you're having all of your activities. So it is definitely very manageable, but not necessarily curable. That's a good question.
Does the overuse of cell phones lead to hearing loss? Sudhir Golikiri, ma'am.
Very good question, Sudhir. So, the maximum output, which is like the ceiling of a room, when the sound is amplified, there is a maximum output. With some of these cell phones, the maximum output is pretty loud. So if you turn the volume up all the way and you're on the phone a lot, uh, that that can, especially if it's on the phone a lot, or that can sometimes lead to ringing in the ears, but it may not necessarily lead to hearing loss. I've had some patients though who have had sudden hearing loss due to a loud sound from the cell phone. So that is usually occasional. It is not very common though. Hope I was
The
able
next
to answer
question
that
is,
question.
which ones are good, headphones or earphones? Shivdas Pai.
Very good question. So either one will work. In matter of comfort and the quality of the music that you're going to listen to. The more the seal there is, and you can have that, like the earbuds I'm using have a good seal in my ears, because I can hear the full range of frequencies. As long as it's not turned up very loud, I think you should be fine with either. It's a matter of comfort, really. The personal preference, correct.
Does homeopathy help in treatment of problems arising in hearing, especially for tinnitus? Naganand Nileshwar.
It's a very good question. All these questions are awesome. I don't want to touch that question with a 10-foot pole because only because homeopathy has definitely great benefits for a variety of things. I personally have not seen that either yes or no, meaning whether it has positive effect or negative effects. I have not personally seen that. That doesn't mean it does not work, but there may be some medications, homeopathic medications, that might resolve. And by the way, a lot of these medications also have what's called placebo effect, which is I can give you something and say that's going. In fact, there is something called riboflavonoids that are available in the stores here, and some physicians will write prescriptions for that. There is no scientific evidence to show that it works, but hey, a good 20-30% of the people actually find benefit from it. So be it. If it helps them, that's wonderful.
Can hearing aids help tinnitus?
Very good. This is one of the best questions. So when there is a hearing loss, okay, when you provide more stimulation from the ear to the brain, that resolves the tinnitus. It doesn't cure it, but it completely masks the tinnitus. And people who have tinnitus and hearing loss, both, if they address the hearing loss with hearing aids, that can resolve the tinnitus issue.
Next question is from, is it necessary to wear earplugs while swimming? From Ravikiran Nileshwar.
Not necessary. It is not really necessary. It would be necessary if you had ear issues, meaning if you had an ear infection or eardrum problem or something, but generally it's not a need for it. Now, some people wear them if just to keep water from going in their ears. Some people don't like the feeling of water going in the ears. So it's not a necessity, but for people who have problems with their ears, it's a good idea. I know that there is one or two individuals who have raised their hand also, Sarang.
Can we hear better if we look at a person's mouth as opposed not to looking at someone's face?
Indeed.
From Cliff.
Indeed. Very good question. So as you have hearing impairment, you tend to depend more on the visual cues of speech, as I said earlier. So yes, you can. So for relatives of someone who has hearing loss, it is important for us as relatives to understand that, hey, if I'm talking to someone with a hearing impairment, please make my face more visible to them. Don't talk when I'm walking away, or if they're walking away, be mindful that you're able to have them see your face when you're talking to them. Try to avoid speaking to them when there's loud noises around. If they're washing their hands in the sink and you're trying to talk to them from behind, sometimes it's difficult for them to understand what's being said. So just being kind of aware of these types of things. Don't speak in competition with other noises. And one of the worst things that one can do is to talk very loudly. That I do not recommend that. The best way to address this is to come closer to the individual with the hearing loss and speak in a normal tone of voice, but a little bit slower. So don't speak 100 miles an hour. Just slow down your rate of speech, and that makes a huge difference for the person with the hearing loss. I've been very privileged to have been able to help my mother with a hearing impairment for years, and I know she does thumbs up right now. So and I know how she has been struggling with her hearing impairment. So I know that firsthand. Sarang and OnePlus both have questions. They
Yeah.
raised their hand.
Wow.
Sarang.
Yeah. So 1 second, because yeah, I'll
Okay.
have to unmute everybody. Then
Okay.
so it
That's
probably
fine. If you can
it's
hold
safe.
your questions, Sarang and OnePlus, I will address them in
Yeah,
just a
yeah.
moment.
Is it safe to have earbuds in the ears while working out? Does that eventually lead to loss of hearing?
No, it does not lead to. So you're talking about earbuds when you're listening to music or something when working out. It cannot lead to hearing loss, provided, as I said earlier, the music you're listening to, whatever you're listening to, is at a moderate level, not turned up too high. Just be mindful of that.
Okay. I think the last one, should one always wear hearing aids all the time, or can someone remove it when at home from Cliff?
I cannot say how important this particular thing is. First of all, every one of these questions are gems. So think about this. With someone with normal hearing, I know this is kind of a stretch. With someone with normal hearing, can I take my ears off my head and put it on a shelf when I'm at home? No. What I'm saying is, I'm hearing the world of sound, whether maybe some fans on, or somebody is vending outside, or there's somebody's doing dishes, or other sounds in the environment are going on. My brain is constantly aware of those sounds, right? So what I'm getting at is, if you wear hearing aids all the time, even if you are at home by yourself, you are aware of your environment. The brain is familiar with these environmental sounds. So when you're actually having a conversation with somebody, um, in the presence of those sounds, the brain is already used to hearing those sounds. So it's easier for the brain to block out those sounds and listen to speech. So the answer is yes, it is better to wear hearing aids during all your waking hours. That's a very good question, Cliff. Thank you.
Thank you. Now, Sarang.
Okay. Okay. I have two small questions and one little bit longer one.
Sure.
Hydrogen peroxide, you said to clean the wax in the ear. If you put hydrogen peroxide, it would loosen it up. But how would you take it out? I have somebody who's totally disabled, so I don't want to put anything in the ear, but I can put hydrogen peroxide in his ear. That's my husband. And how would I get it out?
Yes, so let me answer that question first. Very good one again. You're right. Hydrogen peroxide will only break down the earwax. It will not remove it. You have to flush it out. So you have to get a little bulb and carefully wash out the ear canal with, once you have treated the ear with hydrogen peroxide, you have to wash it out. It's not good to leave the hydrogen peroxide in the ear canal, because that can only irritate the skin in the ear and cause more problems. So once you treat the ear with hydrogen peroxide, it's best to wash it out. And your
How much
second
hydrogen
question?
peroxide should I put in the ear? And
Generally, if you look at the instructions, it's a carbamide peroxide. It's not just pure hydrogen peroxide, although you can use hydrogen peroxide, but generally they use carbamide peroxide, which is store-bought ear drops. And they normally recommend about 4 or 5 drops in the ear, that has the earwax. But you can look at the directions. Every one is a little bit different. But you will actually, the person who's having those drops put in the ear will actually hear some bubbling going on, because it's breaking down that wax. And that's normal, by the way. If you experience that, don't be frightened. It is just breaking down the wax. And then you just have to wash it out after that with a rubber bulb. Don't use hot water or cold water. Use body temperature water, because if you use hot water or very warm water or very cold water, that can cause a little bit of dizziness. It's called a caloric response. So you try to use body temperature water if you can. Good
the instructions for how long to keep it in would be on the box that I buy.
Yes, but I would say generally about 10 to 15 minutes.
10 to 15 minutes.
Yes, after you use the drops, correct.
And the bulb that you mentioned, I can buy that just for cleaning the ear, right?
Yeah,
It's available in the store.
the kits usually will have the bulb and the drops together. You can find that
Okay.
in combination there, correct?
Okay, that's
But you
first
know,
question. Second question is,
as I mentioned earlier, plain mineral oil, just plain baby oil is what we call it. Just using 2 to 3 drops of baby oil once a week in each ear will keep the wax soft enough and it will not build up near as much. So
but
using
how would
baby
it
oil,
come out?
well,
How would it come out?
if you use only 2 to 3 drops once a week, you don't
Yeah.
need to worry about it, you see, and you put it only 2 or 3 drops in each ear canal. You know, when you're taking a shower and stuff like that, it will come out on its own. You don't need to worry about 2 to 3 drops, only once a week though, you see, not every day. So you should be fine with that. Yes.
But again, that person is totally disabled, so he can't clean his ears either or taking a shower. So I would have to do it for him.
You would have to do it.
In which case, what you're suggesting is the kit to clean the ear is the thing for me to do, because he can't do it himself.
Sarang, the first step is to be sure that the person has wax. I know that's the assumption, but if you had a way of looking in the ear canal to see if there was a lot of wax, then do the needful. Don't use hydrogen peroxide if there isn't a buildup of wax. Okay?
Okay.
Thank you.
No, I have a couple of questions though. I already mentioned. Can neti that we do for cleaning your sinuses, is there a warning there that says the water can go towards your ear? Can it cause ear problem?
No, generally not. So unless you have a nasopharyngeal problem or if you have a medical problem that has previously been identified, neti is perfectly fine. In fact, people who have allergy problems, when you do the neti, it really is very, very beneficial. Be sure that you use good water, clean water, distilled water. Don't use tap water. Sometimes that can cause issues. So it's a good question, and it should be fine to do it. Correct.
Okay, one more last question.
Sure.
You mentioned something about the opening from your inner ear to the eustachian tube to keep the air balance. Maybe I'm not using the right words, but I have had dizziness and imbalance for a long time now. The pressure was checked in the inner ear at that time, and then the ENT guy said there was nothing wrong. It was balanced, but the dizziness hasn't gone. But I do have, like, this might not be a question for you. I have multimodular goiter, which means it's a growth inside the throat.
Yes.
Could that be causing the air from going from my throat to my right ear? It's on the right side.
Very good question. Sometimes if that is blocking the eustachian tube, you can have problems with that. But that may not be the cause of your dizziness. There could be other things. And I'm happy to address this one-on-one with you offline. I've shared my email address. And
that was Nileshwar at
hotmail.com.
At hotmail.com.
Yes.
Okay, I will write to you. I don't want to bore everybody.
Very good question.
Thank you very much.
Sure. You're welcome. That's what I'm here for.
Yeah, you can ask Mom now.
Yeah, Ram, this 1 + 60 is Kishore Nileshwar.
Oh, yes, Kishore. Yes.
Yeah, I have a question related to something you probably already touched upon. That's the growth in the middle ear. This is specifically related to glomus. If somebody has glomus in the ear, then can it affect the eyesight over a period of time?
No, generally, to my knowledge, it does not affect eyesight. The glomus, it's sort of a growth in the throat to ear, middle ear space, that area, and that is generally removed under careful surgical supervision. Is done by surgeons. Generally, it's removed, but unless it is an area of the ear or throat where it's close to a nerve, then they sometimes won't do the operation at all. But that will not lead to any vision issues, to my knowledge. No.
So a corollary to that is if the glomus is left unattended without surgery, then would that cause some problems to crop up over a period of time? What's your experience on that?
So again, you know, I'm not a physician, so I don't want to get into the area of that. A physician would say, hey, Ram, you're an audiologist. How dare you talk about my area of expertise, right? So to that extent, I would defer that to a physician. But Kishore and I would love to discuss this with you one-on-one offline. we'll certainly do that and see what if you or somebody else is experiencing this, it has to be addressed. Absolutely.
Okay, thank you so much, Ramu. It's
You're
been
welcome.
a pleasure listening to you, and
Likewise.
God bless you.
Thank you.
Thank you. Thank you. So now what I'm going to do is I'm going to let everybody unmute yourself and talk or ask questions, but I'm going to stop recording so that, we have a YouTube channel where we will be putting this up. So people who are back home in India, it's late now. If you want to go back to sleep and watch it again tomorrow or later, we will send you the link.